About primary HLH. What is GAMIFANT? GAMIFANT is a prescription medicine used for the treatment of adults and children, newborn and older, with primary hemophagocytic lymphohistiocytosis, HLH, whose disease has come back or progressed, or other medicines have not worked well enough or cannot be tolerated. Important safety information. GAMIFANT can cause serious side effects, including infections. GAMIFANT is a medicine that affects your immune system and may lower the ability of your immune system to fight infections. GAMIFANT may increase your risk of serious infections that can lead to death. These infections include tuberculosis, TB, histoplasmosis, herpes zoster infection, shingles, and other infections caused by viruses, fungi, or bacteria that can spread throughout the body. Your healthcare provider will test you for TB before you start treatment with GAMIFANT, treat you with a medicine for TB if you are at risk for TB, or if you have a known positive TB test. Infections are common in people treated with GAMIFANT. Please stay tuned for the important safety information at the end of this video. As babies, we inherit lots of qualities from our parents. Some we notice right away, like our mother's eyes or our father's smile, and others, like great-grandpa's sense of humor, may show themselves with time. Unfortunately, certain illnesses may also be passed down through families. Primary hemophagocytic lymphohistiocytosis, or HLH, is a rare genetic disease that can be passed down from parents to children, and someone who seemed fine might suddenly begin to experience concerning symptoms. In a normal immune system, many cells and organs work together to protect the body. Immune cells travel through the body looking for harmful cells. When they find something suspicious, they alert T cells, which come to the rescue to destroy these cells. But they can't do it on their own. T cells release inflammatory messenger proteins called cytokines, and cytokines activate macrophages to help get rid of the problem. Macrophages are large cells that eliminate harmful cells by consuming them. In an immune system affected by primary HLH, the macrophages and T cells aren't able to get rid of the problem. But the body keeps trying, creating more macrophages and cytokines to destroy the harmful cells, which causes inflammation. Interferon gamma is a cytokine that plays a key role in primary HLH. It triggers the overactivation of macrophages, which release even more cytokines. The excess release of cytokines creates a cytokine storm, which causes inflammation to get out of control. As a result, long-lasting fever and other serious symptoms of primary HLH can occur, which may lead to permanent organ damage. Important safety information continued. Before starting GAMIFANT, tell your healthcare provider all of your medical conditions, and if you had TB in the past, or if you or a member of your family have been in recent close contact with someone with TB, have had a positive TB skin test, purified protein derivative test, currently have an infection or have a history of infections, including histoplasmosis or herpes zoster, shingles, are being treated for an active infection, have symptoms of an infection such as fever, sweat and chills, cough, breathing problems, blood in mucus, phlegm, or warm, red, painful skin or sores on your body, are pregnant or plan to become pregnant. It is not known if GAMIFANT can harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if GAMIFANT passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby during treatment with GAMIFANT. Your healthcare provider will give you medicine to help prevent certain infections before you receive GAMIFANT. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. After starting GAMIFANT, tell your healthcare provider if new symptoms of an infection appear. Symptoms of an infection that you already had when starting GAMIFANT worsen. Your healthcare provider will monitor you closely for signs and symptoms of infections during treatment with GAMIFANT. GAMIFANT can cause serious infusion reactions. These are common, can also be severe, and can happen during or shortly after treatment with GAMIFANT. Your healthcare provider may temporarily stop your infusion and treat your symptoms before continuing your infusion if you have severe infusion reactions. Tell your healthcare provider right away if you get any of the following symptoms: skin redness, itching, fever, rash, excessive sweating, chills, chest pain, shortness of breath, nausea or vomiting, lightheadedness or dizziness. The most common side effects of GAMIFANT include high blood pressure, hypertension, and fever. These are not all the possible side effects for GAMIFANT. For more information, ask your healthcare provider. You can also see the full prescribing information for GAMIFANT, including patient information, at https://gamifant.com/pdf/prescribing-information.pdf. To report suspected adverse reactions, contact SOBI North America at 1-866-773-5274 or FDA at 1-800-FDA-1088. Please see medication guide for GAMIFANT at www.gamifantcares.com/pdf/gamifant-med-guide.pdf. Thank you for watching. Visit gamifantcares.com to view additional videos about primary HLH.